From a recruitment point of view, I think the debt load is amazing, but we have to recognize that Memorial Medical School has one of the lowest tuitions. It's about half of the Ontario schools. So if you're looking at recruiting people who have gone to other schools, their debt load is in excess of the kind of debt load that students would have here. So it makes it, we start out in a hole and we get further and further down.
I want to speak about the concept of fair compensation. You know, one of the things that I find particularly frustrating as a rural psychiatrist is that many of my family physician colleagues in the community make similar income to what I do, and I'm a specialist, and I have highly complicated patients, as we've identified, with considerable amount of risk and a higher burden of on-call. So some of this really has to go speak to the fact that, look, if you want people to go and do extra years of training, assume additional debt, assume additional liability and complexity, then they should be fairly compensated.
The context, I guess, in which you're sitting here talking to us today can't be ignored. What do you make of what's gone on in the House of Assembly over the last few days, the government's reaction, first of all, to the fact that it's indicating that the NLMA has absolutely lost the right to bargain for doctors? Could you speak to that, if you would?
Well, I think that with regards to the recent proposal that was sent to us, you know, I think all three of us would agree that we would defer that to the NLMA and their board of directors. And but I guess it's a difficult situation. I think that for myself, that the NLMA negotiates for me. I feel confident in their ability to negotiate for me. I feel that the environment that is there, that not all of us are going to agree on every point, and that's inherent. You know, whenever you get a group of people, not everyone is going to agree on everything, but I think that it's a democracy and we all have an open forum that we can express our opinions, and so I feel like we are well represented there. I don't have first-hand experience of dealing with the government, so I guess I can't really comment too much with that.
Isn't it all dispiriting when you hear the tone of the conversation and the comments being made?
It is very discouraging. And many times, you know, I think personally I feel disrespected by it, but at the end of the day, you still have to go into work and you still have to provide a level of care that's, you know, that's going to treat your patients to the best of your ability and the best for them. So you sort of have to park that at the door when you go to work in the daytime, because the task at hand is to look after people.
It's interesting, the question you ask us, we often get asked by our patients as well. Our patients, I think, are very much aware of the climate in which we practice, and they're very much aware sometimes of some of the difficulties that we have. And we share some of those difficulties, I think, sometimes. But again, you park it at the door. It's not about the care you provide. And I would say that waiting lists and some of the Band-Aid care, the care that you actually get once you get there is second to none, I don't think, in this country, in the sense of that acute psychiatric piece. It's the early intervention and prevention piece that are difficult. And we just have to remind ourselves that we do a lot of good work in the course of the day.
How helpful is it, though, in the context of where you are now, to have the government of the province with whom you're negotiating out there saying that the organization which has the right under legislation to bargain for you has no right to bargain for you, and is a house divided, essentially? Dr. Luscombe, would you?
I have to admit that, you know, the specifics of that issue, you know, I haven't really worked through personally. We recognize that in any negotiation process, you know, I recognize that the government has to protect the public purse too. So we recognize that, you know, some of their activities and interests are driven towards, you know, cost containment. So I understand, and we recognize that, you know, what things are said politically and the posturing that occurs are all part of the process. And we're just very much, I'm just here looking for solutions, and I want to focus on how the solutions are going to occur, and the NLMA holds my confidence.
I think that a lot of people, what I'd like for people to realize as well is we advocate for our patients and we want the system to improve for our patients, but we're patients too. You know, if the system is not working, then the system is not going to work for me when I need it. And the system's not going to work for my parents when they're sick, or, you know, my husband's family when they're sick. You know, we access the services too. So if the services are not there for our patients, then they're not there for us, because we're all patients of this system. So we all have a vested interest as providers and as patients to improve the service delivery in this province.
It's a difficult, sorry, I was just going to say, I think it's difficult when you have a body negotiating for whether it be nurses or teachers, because there are so many different groups, even within nursing, within teachers, within the House of Assembly, that I think you have to go with the majority and give them other people an opportunity to speak. Do I think that it's possible in this day and age to get however many doctors there are to all agree on how everything should be? I don't think it's possible. I don't think it's realistic. Does that mean that the NLMA shouldn't have the mandate? I think there's opportunity within the NLMA for people to speak. There's opportunity within colleagues to speak. So I think that there is a democracy there. And unfortunately, in the end of the day, just as we have a government that was voted in because they got the most votes, doesn't mean we all agree with them at the end of the day.
How much does, with your particular problems in mental health service, I've heard this over the years as I do stories. It's just not. It's not heart attacks. It's not emergency room backlogs. It doesn't get the same political reaction when it comes around to budget time and all those things. It doesn't get the same treatment. And obviously for monetary issues like pay, it's the same issue. You know, the psychiatrist is not getting the pathologist pay, that sort of thing. Can you speak to that at all?
You know, having depression is probably not as out there or as sexy as some of the other things that you can have.
Yeah.
Most people that have it have enough trouble getting up out of bed, never mind trying to have to access service. If I was in a prominent position and perhaps someone that actually had the means to advocate, I would probably find it easier to do that if I had heart disease or cancer than I would if I had depression. Even as a professional, I think there's stigma within that. Do you want everybody to know that you have bipolar disorder even though you're well controlled? Well, probably not if you're in a high-powered job. So I think it's really, really hard to advocate. I think that, you know, if you look at who votes, middle-aged men with coronary artery disease are a very powerful group of people that vote. They really do, and they have a lot of say, and a lot of them have a lot of ability to advocate. So
and I think it's more, I think that the stigma that is still there with mental illness affects where that money gets distributed, because, you know, if you're sitting around with a bunch of people, you're not, you know, you're not too shy in saying, yeah, I had to go see the orthopod because I got to get my hip replaced, or, you know, Dad had a heart attack last week. You're probably not going to jump up and down and say, Mom was at the Waterford and had to have ECT last week. And there's nothing wrong with Mom being at the Waterford and having ECT, and thank God she's getting the treatment that she needs. But you're not going to run out and you're not going to tell people, we don't have telethons for the Waterford Hospital. I'm grateful we have telethons for the hospitals we do have them for, because we need them and people need to continue contributing to them. But you're not going to see a telethon, you know, with a bunch of patients who have bipolar disorder. They're talking about how much better they feel. And that's where the stigma to society comes from. And, you know, politics is politics, and things that are, you know, sexy get, you know, the attention at the time. So, you know, hopefully throughout everything that, you know, there'll be a more equal representation of care for everyone.